Welcome back to our podcast series. Today, we will be discussing something that's rarely talked about, and that is male breast cancer. You may think that this is rare, and it is, but let's look at some of the stats. Although breast cancer in men is rare, in the USA alone, about 1,900 new cases were diagnosed in 2009, with 440 of these cases resulting in death. More alarming still, according to the Breast Health Foundation in South Africa, it is estimated that South Africa has the highest incidence of male breast cancer in the world, with between 1 and 3% of breast cancer cases diagnosed occurring in men. So, what are the risk factors? According to healthline.com, these are some of the symptoms and the risk factors to look out for. Let's start with the risk factors. Getting older. Most breast cancers are found after the age of 50. Then, the next one, a family history of breast cancer, radiation therapy treatment, hormone therapy treatment, Klinefelter syndrome, which is a rare genetic condition in which a male has an extra X chromosome, certain conditions affecting the testicles. These can include injury to, swelling, or surgery. Liver disease, bearing in mind that cirrhosis or scarring of the liver can lower androgen levels and raise estrogen levels in men. Being overweight or obese. But that being said, although these listed risk factors can increase a man's chance of developing breast cancer, it does not necessarily mean that they will. But what are some of the possible symptoms to look out for? The most common are a lump or swelling in the breast, redness or flaky skin in the breast, irritation or dimpling of breast skin, nipple discharge, pulling in of the nipple, or pain in the nipple area. Much like all cancers, treating male breast cancer depends on how big the tumor is and how far it has spread. Treatment will typically include surgery, chemotherapy, radiation therapy, hormone therapy, and the like. As with all cancer treatment, costs can spiral into the hundreds of thousands, with medical schemes unlikely to cover the full cost of treatment. This is where taking out a cancer cover is essential. Luckily, for men whose female partners have invested in the female cancer cover policy with total risk administrators, you automatically qualify to take out one of their product options, which covers you for prostate, testicular, penile, bladder, and male breast cancer from as little as 75 Rand a month. Bear in mind that male breast cancer cases that result in death are usually because the cancer is detected too late, usually at stage 3 or 4. So the message here is seek immediate help should you experience any symptoms or changes. More important, if several members of your family, male or female, have had breast or ovarian cancer, or a family member has a known BRCA1 or BRCA2 mutation, you may want to share this information with your doctor, who will probably refer you for genetic counseling. This is important as these mutations can increase the risk of not only breast cancer, but also high-grade prostate cancer and pancreatic cancer. Other than that, you can lower your risk by maintaining a healthy weight and remaining physically active. Do not mistake the possible signs of male breast cancer. It can and does happen. Stay healthy, everyone.